Hello and welcome to our channel, where we explore essential health wisdom for seniors. Today, we're diving into an urgent and trending topic: how RSV or respiratory syncytial virus poses a serious and often overlooked risk to older adults, especially when it comes to heart health. You might have thought RSV is only something babies get, but research now shows that RSV in seniors can significantly increase the risk of heart failure and irregular heart rhythms, even in those with no history of heart problems. So, in this video, we'll explain what RSV is, how it affects older adults differently, why it's connected to the heart, what the latest studies say, and most importantly, how you can protect yourself or your loved ones from this growing threat. What is RSV and why it matters to seniors? RSV, or Respiratory Syncytial Virus, is a common virus that causes infections in the lungs and respiratory tract. In children, it's one of the most common causes of bronchiolitis and pneumonia. But here's what many people don't know: RSV can be extremely dangerous for older adults. As we age, our immune systems weaken, making it harder for our bodies to fight off infections. RSV in seniors doesn't always show dramatic symptoms like in children. Instead, it may appear like a common cold, but quietly progress into something much more serious like bronchitis, pneumonia, or now, as studies reveal, heart failure. How RSV impacts the heart. So how does a virus that affects your lungs impact your heart? It all starts with inflammation. When RSV infects the lungs, the immune system releases chemicals to fight off the virus. This causes inflammation not just in the lungs, but throughout the body, including the cardiovascular system. For seniors whose hearts may already be weaker, or who may have underlying conditions like hypertension or diabetes, this added stress can push the heart past its limits. It can lead to worsening of existing heart failure, new onset of atrial fibrillation and irregular heartbeat, fluid retention, and pulmonary congestion, even sudden cardiac complications. It's a silent storm that begins in the lungs but ends up overwhelming the heart. Recent studies and shocking findings. A recent Canadian study analyzed over 100,000 hospitalized patients, comparing outcomes for those infected with RSV, influenza, and urinary tract infections. The findings were stunning. 18.5% of patients hospitalized with RSV developed cardiovascular complications. Heart failure occurred in nearly 11% of RSV cases. Atrial fibrillation occurred in about 6%. These figures were much higher than in patients hospitalized for influenza or UTIs. This means that RSV in seniors has a significantly stronger impact on the heart than previously recognized. And what's even more concerning, many of these patients had no prior history of heart disease before they were infected. Symptoms to watch for. It's important to recognize RSV early, especially if you're 60 or older. Look for persistent cough, wheezing or shortness of breath, nasal congestion or runny nose, fatigue or weakness that doesn't improve, low-grade fever or chills. But if RSV begins affecting your heart, the symptoms can be more severe and include sudden swelling in the legs or ankles, trouble breathing while lying down, irregular heartbeat or fluttering sensation in your chest discomfort or pressure, unexplained weight gain from fluid buildup. Don't ignore these signs, especially during cold and flu season. They could indicate more than just a respiratory infection. Why vaccination is crucial. Thankfully, there's good news. As of 2023, the FDA approved the first vaccine specifically designed to protect adults over 60 from RSV. The vaccines developed by GSK and Pfizer have shown strong results in clinical trials. They reduce the risk of RSV-related illness by nearly 80%, and they offer critical protection for the most vulnerable seniors, especially those with chronic illnesses. Doctors now recommend RSV vaccination alongside your yearly flu shot and COVID-19 booster. These three vaccines together can build a powerful wall of defense. Who should get the RSV vaccine? Health experts recommend RSV vaccination for adults 60 years or older, seniors with chronic heart or lung conditions, people with weakened immune systems, residents of nursing homes or assisted living, caregivers who are frequently exposed to infections. Talk to your healthcare provider to determine if the RSV vaccine is right for you. Prevention beyond vaccination. In addition to getting vaccinated, here are ways seniors can protect themselves. 1. Avoid crowded indoor spaces, especially during RSV season, fall and winter. 2. Wear a mask in high-risk settings, hospitals, clinics, or public transit. 3. Wash hands frequently. RSV spreads through touch and respiratory droplets. 4. Disinfect surfaces. RSV can live on surfaces like doorknobs and countertops. 5. Stay active and hydrated. Keeping your body strong helps you recover faster. 6. Monitor your heart regularly. If you're recovering from any infection, keep an eye on your pulse, blood pressure, and breathing patterns. Real-life stories and impact. Let's take a moment to reflect on how this issue is affecting real people. Many hospitals across the US and Canada are reporting rising RSV admissions among older adults. Some patients came in with a mild cough and left with a new diagnosis of heart failure. One senior shared how a simple cold turned into a 6-day hospital stay with fluid in her lungs and heart rhythm issues, all because of RSV. These stories highlight how critical it is for the elderly to take RSV seriously, not just as a cold, but as a real cardiac risk. RSV is no longer just a childhood virus. For older adults, it's a growing health threat that could trigger life-threatening heart complications. But the good news is there's action you can take. Get vaccinated. Recognize the early signs. Monitor your heart health. Don't wait until symptoms worsen. Talk to your doctor today. A proactive approach can protect not just your lungs, but your heart and your life. Have you or a loved one had RSV or heart issues recently? Share your experience in the comments. Your story might help someone else. If you found this video helpful, please like and subscribe Timeless Truths to stay informed on more essential health updates for seniors. And we'd love to hear from you. Stay safe, stay strong, and thank you for watching.